What is depression disease and how to recover your mind?
Depression is a mental health disorder characterized by feelings of sadness, hopelessness, and a lack of interest in activities. It can affect how you feel, think, and handle daily activities like sleeping, eating, or working. Depression is more than just feeling down. It's a serious condition that can impact your mental and physical health. Common symptoms of depression can include persistent feelings of sadness, anxiety, or emptiness, loss of interest or pleasure in activities once enjoyed, changes in appetite or weight, sleep disturbances, insomnia or excessive sleeping, fatigue or loss of energy, feelings of worthlessness or guilt, difficulty concentrating or making decisions, irritability or restlessness, physical symptoms such as headaches or digestive issues, thoughts of death or suicide. How to healing this thing? Depression treatment. There are both drug and non-drug treatments. In some people, a combination of several methods may be required. It depends on the symptoms and severity of the disease. The method of treatment is as follows. 1. Psychotherapy treatment. It is a treatment method based on psychological theory. It is one of the most effective treatments for reducing symptoms of depression. There are many forms of psychotherapy, including supportive psychotherapy. Psychotherapy that focuses on adjusting thoughts and understanding behavioral psychotherapy. The therapist will consider the form of therapy as appropriate to the patient's symptoms. 2. DTMS treatment. The brain of people with depression releases and receives chemicals that are abnormal. DTMS, deep transcranial magnetic stimulation treatment, involves releasing electromagnetic waves to stimulate the brain in the desired location. Similar to the action of medicine, inducing the release of electrical charges to balance all parts connected to the stimulated brain, helps chemicals in the brain return to normal functioning. 3. Drug treatment. When using medication, side effects may occur as follows. Tricyclics group of drugs. Side effects include dry throat, dry mouth, constipation, dizziness, blurred vision, dizziness when changing positions, fast or irregular heartbeat, drowsiness. Tetracyclics group of drugs side effects are dry mouth and extreme sleepiness. Triazolopyridines group of drugs. Side effects are extreme sleepiness, dizziness, low blood pressure while changing work positions, headache. NDRI drug side effects include dry mouth, difficulty sleeping, nausea, and vomiting. SSRI group drugs. Side effects are nausea, vomiting, headache, diarrhea, may have insomnia, and decreased sexual desire. SNRI group drugs. Side effects include dry mouth, dry throat, nausea and vomiting, insomnia, and decreased sexual desire. Side effects of drugs that come from the neurotransmitter serotonin are increased. Causes symptoms of serotonergic effect, muscle spasms, tremors. These symptoms can be reduced by taking antihistamines together or stopping the medication. The symptoms will disappear within 24 hours. All treatment procedures will be assessed by a psychiatrist. To consider the medicines to be used for treatment starting at a low dose first. Then make an appointment to follow up on treatment results. Before adjusting the dosage, everyone. 2 weeks until good treatment results are seen. Taking medicine doesn't mean you'll get better immediately after taking it, but you must see a psychiatrist to evaluate the treatment. When the patient's condition improves, you may need to take the medicine continuously for another 4-6 months, then gradually reduce the dose until you can stop taking the medicine to prevent it from coming back again. Taking care of yourself when you are depressed. 1. Don't set goals for your work. Behavior that is too difficult or take on too much responsibility. 2. Isolate big problems. Make it into small sections, along with arranging priorities and doing as much as you can. 3. Don't try to force yourself or set yourself too high a goal, because it may increase feelings of failure later. 4. Try to do various activities. Together with another person is better than being alone. 5. Choose activities that create a better feeling, or enjoyable and not too heavy, such as watching a movie, light exercise, participating in social activities. 6. Do not make decisions that are very important to your life, such as quitting your job, getting married, or getting divorced, without consulting close people who know the patient well and must be a person who can honestly consider that event neutral and without bias caused by emotions to obscure. 7. You should not criticize or punish yourself for not being able to do what you want, because it's not the patient's fault. You should do as much as you can. 8. Do not accept that the pessimistic thoughts that occur in depression are an intrinsic part of yourself, because it is actually a part of the disease or illness, and can disappear with treatment. 9. As people with depression become people who need help from other people, there may be people around them who do not understand the patient's illness and may respond in the opposite direction, becoming unintentionally aggravating. And how to caring for patients with depression. Understanding the disease that the patient has. It can help relatives reduce expectations, frustration in the patient. Deep listening. Listening to the patient with understanding, attentiveness, and non-judgment will help the patient's feelings improve. Express feelings. When the patient vents his thoughts, various bad feelings come out, especially thoughts of suicide. It will help relieve tension in the heart. Exercise. Exercise helps the patient's body be strong and the mind bright. If you exercise with others, it will help increase social interaction. Don't feel alone. Change the atmosphere. The patient should be taken on a trip for a change of scenery. It will help keep the patient's mind clear. Freshen up in another way. Prevent self-harm. Relatives must be careful of patients harming themselves by collecting equipment that patients can bring to harm themselves from the patient. Observe symptoms. Always observe the patient's symptoms to see if they are sad, stressed, or thinking of harming themselves. If talking doesn't get better, should be taken to see a doctor to discuss symptoms. Take care of routine. Follow patient medicine. Relatives should help take care of the patient's daily activities, such as eating properly. Wake up and sleep at the same time, including following up on taking medicine as prescribed by the doctor and being patient, because treatment takes time to show results. Depression. If you try to help yourself in many ways, such as doing more activities, adjust your thoughts. If you find a friend or counselor to help you, it still doesn't get better. And observe yourself to see if your life is unbalanced, unhappy, and has behavior that described before. It is best to consult a medical professional in order to receive timely treatment. With love and care.